The global healthcare sector is witnessing a significant transformation. And among this significant transformation, the hospital sector turns out to be an emerging critical aspect. Talking Point connects with Mr. Diptilokuarachi, the CEO of Lanka Hospitals. Greetings to you and welcome to the show.
Yeah, thank you. Good morning.
You are holding numerous key positions in other fields. What inspired you to pursue a career in healthcare, and how has your vision contributed to the growth and development of the hospital sector?
Well, in my career, I have been working in the insurance sector for 27 years, and at the age of 55, I had to retire because I happened to be associated with an insurance company that was owned by a bank. So as per the retirement policies of the bank, and that was also applicable onto their subsidiary insurance company, when I reached 55 years, I had to retire. So I opted out of the insurance sector at the age of 55, and then this position at Lanka Hospitals was available. And there was a public advertisement that was actually, put up by the hospital. So I responded to the application, or not the application, the advertisement, and then I was chosen to be the CEO. So that's exactly how I actually changed my job positioning. I don't call my present job as part of my career, but I would say that my career was in the insurance sector. But whereas, this is a new assignment, which has some, similarities with the insurance sector, hospital sector and the insurance sector. There are, many things in common. So basically, I'm happy that I'm in this sector so that I can see the other side of the coin.
In what ways has your hospital implemented innovative medical practices and cutting-edge technologies to enhance the quality of patients' care and outcomes?
When we are actually in an organization that serves the community through healthcare systems, obviously the expectations and the bar is very high. In fact, people actually turn out to the hospitals when they're actually in destitute situations. You may be a rich person, you may be a poor person, but eventually when things pertaining to your health gets out of control, invariably you have to have recourse to a hospital. So irrespective of the social strata, whether you like it or not, people will obviously have to basically have recourse to the hospital and for the facilities in a hospital. So in that context and in that background, the hospital has a bigger responsibility. We may be, conducting an activity which, if you take the hospital that I represent, this is actually at the moment it's a state-owned enterprise, but there are similar hospitals in the tertiary care market, and in this market people have invested into the hospital business. So when shareholders actually invest into the hospital business, they expect a return. Obviously nobody is going to invest in any business unless there is a return. So similarly in this area too, whoever who established the hospital and whoever who actually gets involved in a similar business have invested considerable amount of money in order to build the infrastructure of the facilities, and eventually what is really expected is, you have to ensure that within this investment proposition, there are various stakeholders who are really interested in. So in as much as the shareholders are interested in a return, eventually we need to understand that we are serving an end consumer, in the patient, and then not only the patient, but there are people who are actually interested in the well-being of people who are being treated in a hospital. So in that context, as a hospital, we are always striving to get the best patient's outcome, or the best outcome to the patients and their families. So because if you save a life, it goes a long way for the patient as well as for the family. So therefore, it is important that we use the correct approach, and the treatment methods needs to be to the precision, and we can't take actually, there cannot be errors or omissions when you're dealing with the human life of a person. So therefore, quality together with the application, as well as the infrastructure that we are using in the hospital facilities, needs to be at the topmost level.
How does your hospital prioritize patient well-being amidst the challenges healthcare landscape? And what steps have you taken to ensure the highest standards of care and safety?
So primarily, I must tell you that let's go to the latter part of your question in relation to patient safety and patient's well-being. So we remain the only hospital in Sri Lanka that is accredited by the Joint Commission International through their gold standards, and so the JCI standard together with the CAP accreditation, we are the only hospital that has actually both accreditations. So whereas the CAP accreditation deals with the quality standards of the lab, then on the other hand, JCI standard actually deals with the quality standards in the hospital, because we believe as a hospital, as one outfit, we believe that diagnosis is very important, because if you don't do the correct diagnosis, then obviously the treatments can go wrong. So therefore, the methods and the procedures that we employ in the lab diagnosis processes will have to be far too accurate. So this is where we have actually gone with the CAP accreditation standards. So the standards actually are the international standards, and then these actually reflect the highest global standards. So basically, we get sample panels from the accreditation body. So therefore, they send samples picked up from other territories are being sent here to validate in Sri Lanka. So that means that they know the outcome of what they have conducted there. They are just checking on how we actually do apply our standards and report the outcome. So that actually ensures to what extent we actually go into detail, and we ensure the quality and how we actually apply our processes in the diagnosis process, because the diagnosis is very important in order to actually commission a treatment. So in the combination of diagnosis and treatment would require adherence to quality. So quality will obviously reflect in a better patient outcome. So there are situations which are manageable, there may be situations which are not manageable when you actually deal with the health of a person. So based on the severity, based on at what moment in time he comes to a hospital, are very important things. But as a hospital, we are committed, we are geared, and our resources are aligned towards meeting all these objectives, towards ensuring a better patient outcome for everybody who seeks our treatment levels.
Could you share some insights when it comes to some notable achievements or initiatives that have significantly impacted the healthcare sector in Sri Lanka, setting your hospital apart as a trailblazer in the industry?
I think we witnessed this 2 years or 3 years before. Basically, with the outbreak of the COVID pandemic, it was actually a global pandemic. Nobody actually knew. The know-how was only available within few government hospitals and within a few consultants and some doctors who are working alongside with those consultants. But actually, when it became a dire need of the society, when people actually were crying for treatment, when they were craving for treatment, and when they actually opted out of facilities, when the facilities, if you remember right, when people were infected, actually people were afraid. People were taken from Colombo to Kandakadu and various places into quarantine centers. So no matter who you are, if you were infected, people were basically taken to these quarantine centers. So it was actually a social stigma. People really were afraid of a COVID contraction, a COVID infection. And then although it was not fatal at that point in time, still the people feared. There was a high level of anxiety among people. But at that point in time, we actually formulated our strategies, our response plan as to how we need to deal with COVID, and we took actually the lead in the private sector in offering a solution for COVID. So that actually resulted in our hospital treating more than 14,000 patients, and from the point of contraction to the point of cure, right? We have been actually adhering to all protocols, and in having done that, we have saved so many lives, right? People who became asymptomatic, people who had severe diseases occurring, people who had comorbidities, who were presented with various other medical complications, and on the one hand COVID hitting them, and the other major illnesses aggravating as a result. So we actually had a very good a coordinated approach between all the consultants, as well as the in-house medical staff, together with the nurses, as well as people who are in the administration. So we brought about one unique proposition to the market, and then this is something where we took the lead and the other hospitals followed suit, and as a result I think the entire nation benefited as a result of that. So as a result of that, I think we have established a benchmark about Lanka Hospitals, how strong we are, how robust we are in taking on challenges, or any health challenge, and converting our facilities into COVID. 3 years back we had COVID, but even tomorrow or the day after, or even 1 or 2 years or 5 years ahead, if you have another pandemic of the same standing, or even of a much more in a much more
sometimes more critical.
More critical. We have created all our facilities. We can actually convert our hospital in less than 24 hours to deal with any kind of viral pandemic. So basically, I think that was a very credible achievement, a tremendous achievement as far as we are concerned. So that was actually a message that was communicated to the Sri Lankan community to believe in Lanka Hospitals, and to walk into this hospital fearlessly, so that walk in fearlessly and walk out in a very safe way.
Certainly, I think Lanka Hospitals have set a platform when it comes to assurance and the credibility and the trust among a patient, isn't it? With the past example which we all went through, which came in as a nightmare.
Yes.
What are your future plans and strategies for further advancing the healthcare ecosystem in Sri Lanka, and how do you envision your hospital's role in shaping the future of healthcare in the country?
So, with the growing socio-economic situation, we see a greater demand for private healthcare in the country. So we have actually identified the areas where there is high demand and where there is a high response by the private sector is needed. So we have basically strategized, and we have mapped our plans, not only in terms of our operational plans. Operational plans needs to be backed with the acquisition of strategic medical equipment, cutting edge technology, training of our staff, etc. So we are working very hard on it. We have worked and we have identified, and then we will in the future roll out to, once we actually acquire some of the new and the modern equipment that is needed, particularly in neurosurgical areas and oncology. Once we acquire all the modern type of assets, we will actually be changing the game, and we will be moving from where we are to another step ahead. In time to come, within the foreseeable period, maybe in the next 1 to 2 years, you will see a rapid approach by Lanka Hospitals towards with the latest and the modern technologies to deal with the health emergencies of the people.
Excellent. What are your unique selling points when comparing with your competitors?
I think what is unique about Lanka Hospitals is that we need to understand the situation that we are in as a country and as a nation. So the question of affordability factors, on the one hand, we see on certain occasions, facilities are not available all over, and then there is a high demand for facilities in the private sector. So the question is that when you talk about the general economic theories, when your demand is more and when your supply is less, then your prices actually goes up. But as a hospital, we have to, as I said repeatedly, I'm emphasizing that fact, we have to be mindful of what the people can afford. At the same time, technology is also not cheap. Technology is also very expensive. Medical equipments are very expensive. The annual maintenance, this is the side that many people don't see, but the annual maintenance contracts, the consumables, the reagents, everything that is being employed in order to conduct an investigation or conduct a test, everything has gone up in price. But at the same time, the people's income levels, we do understand, have not gone up considerably or to that level. So we are very mindful of the prices we could charge the consumer. So what we have as a policy, what we do is we, going by our vision and mission, we need to be the most affordable and the cost-effective provider of medical services to the public. So one thing is the affordability factor, the second thing is reach, and then the third thing is sustainability, because these three things we take a very conscious call, we take a very close look at it, and then based on these considerations we actually offer the right solution at a very affordable cost to the people. So that has been our prime motto. Relatively, if you look at the Lanka Hospitals offerings, the hospital prices are very much competitive than most of the people, most of the other hospitals who are competing in this, who are actually involved in this landscape. So I think the affordability factor, the reach, the access, and availability of procedures round the clock are the main important things that we drive.
When a patient is in need and desperately seeking for a solution for their illness, Lanka Hospital speaks about affordability, which gives them the reassurance and the comfort of saving their lives. We were in an interesting conversation with Mr. Dipti Lokuarachi, the CEO of Lanka Hospitals. Thank you so much for connecting.
Thank you very much. Thank you.